There are different treatment choices to manage men who've got bothersome urinary symptoms, one of which is a green light laser prostatectomy, and the other one is a UroLift implant. How do you decide which one is a better treatment choice for you? Hi, my name is Dr. Charles Chabert. I'm a urologist and director of the Prostate Clinic, and in this video I aim to explore the differences between the two different treatments of a green light laser prostatectomy and also a UroLift implant. Both of them are suitable modern day treatments for men who've got urinary symptoms related to a big prostate, but they're suitable for different men and different prostate characteristics, in my opinion. Let's take a look at both of them and see which one may be more appropriate for you. So to begin with, a green light laser prostatectomy is a form of cavitating surgery. It's a procedure where we actually remove prostate tissue. You may be aware that the prostate grows as we progress through life, and it's this increase in size of the prostate that compresses the outlet pipe of the urethra, causing obstruction. Laser energy in the form of a green light laser, which has a wavelength of 532 nanometers, is an effective way to deliver heat from an energy source through to the prostate, which basically removes excess prostate tissue. It's a very effective way to unblock a bladder. It takes about 45 minutes to an hour to do. Men are in hospital overnight, usually with a catheter, which is taken out the next day. Men are usually then discharged on day one post-op. One of the advantages to a green light laser prostatectomy is it's a definitive treatment, and the recurrence rate or the retreatment rate is at a low level at about 10 years following the treatment. Men get a big improvement in their flow, and their bladder-related symptoms of frequency and urgency and getting up at night gradually settle down within 2 or 3 months following surgery. Green light laser prostatectomy is a great treatment for people who've got really bothersome symptoms and want definitive treatment, but accept that they will have permanent retrograde ejaculation. UroLift, on the other hand, is a relatively new treatment. In my practice, I've been performing UroLift implants since 2013. It's a more minimally invasive treatment than laser surgery, and the aim is not to remove overgrown tissue, but in essence to staple the tissue open to retract the pressure away from the outlet pipe, thus improving urinary symptoms. UroLift is usually performed in a day surgery setting. People go home on the same day after their treatment. They don't require a catheter. Men can have a little bit more discomfort with UroLift than they do with a green light laser prostatectomy. It can take a few days for their symptoms to resolve. The main issue that we see following a UroLift implant is that men can have some stinging and burning and increase in frequency and urgency that usually takes a week or two to subside. One of the advantages to UroLift is that because there's no tissue that's removed, there is no impact from a sexual function perspective. Men have normal erections and normal ejaculation afterwards. So you can see already that when you're deciding on which of these treatments might better suit you, your perspective on sexual function, in particular ejaculatory function, plays a big role in you deciding which treatment you would rather pursue. There are also some prostate-specific characteristics that determine which treatment is better for a particular individual. Crudely speaking, the bigger a prostate, the more obstruction that is there, the greater the residual volume, which is the amount of urine that's left behind in someone's bladder after they pee, the better off someone is to have cavitating surgery in the form of a green light laser. If someone has a smaller prostate that is causing less of a significant obstruction, and that obstruction is less complex in its shape, and someone wishes to preserve ejaculatory function, then a UroLift implant may be better suited to them. To give you some examples, in my practice, the standard man that will have a green light laser prostatectomy might be a man in his 70s with really bothersome urinary symptoms, who may have been on medication previously, but the medication either no longer works or he has side effects from the medication. He wants things definitively fixed and is not too fussed about the potential for retrograde ejaculation. On the other hand, the ideal candidate for a UroLift implant may be a younger man who's more sexually active, who has a smaller prostate but still has bothersome urinary symptoms, and the obstruction is simple in that there is no complex shape to someone's prostate that is easily retracted with the application of UroLift clips. That man does not wish to compromise on ejaculatory function, but he accepts that he may require another treatment in due course. I hope you found this helpful. If you've got questions or comments, please leave them in the dialogue box below. If you haven't already, give this video a thumbs up. Please subscribe to our channel, turn on the notifications so you stay up to date with all things related to prostate. I'll see you next time.